how to care for a G button or gastrostomy button immediately following placement. It takes around 8 weeks for the stomach and the skin around the G button to heal. It is important to take extra care of the button. It is safe for you to bathe your child after a G button has been placed, but for the first 2 to 3 weeks after surgery, the level of the bath water should be below the G button. Once you are ready, wash your hands with warm water and soap, use sanitizer, or put gloves on if needed. We recommend cleaning around the G button site 2 times a day for the first few weeks. You will need the following supplies to clean the G button: cotton swabs, a gentle soap, and water. Dip the cotton swab in warm soapy water. Roll the swab in a circular motion underneath the G button and away from the gastrostomy site. Clean around the entire G button and repeat until it is free of gastric contents or formula residue. Next, dip the cotton swab in warm water and again, roll the cotton swab in a circular motion underneath the G button and away from the gastrostomy site to rinse the area. Use a dry cotton swab to dry the site completely. If the site is left wet, it can cause other problems like skin irritation.